Hi, Dr. Wazen. Can you tell us what is vertigo?
Vertigo is a sensation of movement, typically spinning, rotation, that can happen either spontaneously or due to a change in body and head position.
What are the common causes of vertigo?
The most common cause of vertigo is something called positional vertigo, and that's when you lie down on the floor or in bed and you get that sensation, or if you roll over in bed or you look up or bend over. These are very short episodes, and that's from crystals we all have in our inner ears that are floating off base that would cause that. That's the most common type of vertigo. It's not all vertigo. It's called benign positional vertigo. Another cause of vertigo is called Meniere's disease, and in that the vertigo is much more prolonged, lots of spinning, nausea, vomiting, loss of balance. It's a totally different type, but these are the two most common types of vertigo that we see. And then the third common type of vertigo is what's called migraine-related vertigo, and that is associated with migraine type of a disorder.
How do you go about diagnosing vertigo?
The most important step in diagnosing vertigo is actually listening to the patient's history. So we ask specific questions about when does it happen, how does it happen, what does it feel like, and so on. And that gives us the first inclination as to how are we going to diagnose this. Once we are done with this history part, then we do special testing for vertigo. We measure the hearing system, we measure the balance system, which includes the inner ear and how the inner ear connects and communicates with the eyes, with the brain, and with the feet. And that's all working together to keep our balance system healthy and to protect us from having imbalance and vertigo.
How is vertigo treated?
The treatment of vertigo depends on the diagnosis. So again, vertigo is a symptom. It's not a disease by itself. So once we know the diagnosis, if let's say it is positional vertigo, then the easiest way to treat it is with a maneuver. It's called a positioning maneuver. Epley maneuver is another name for it, Seamont maneuver. These are all different kind of maneuvers that would help reposition these crystals where they belong. Meniere's disease is treated differently. That's treated with medications, and sometimes there are procedures that are done on the inner ear to stop vertigo. So diagnosis comes first, treatment options come next.
What is vestibular rehabilitation?
Vestibular rehabilitation is actually a discipline of physical therapy that is focused on retraining the brain to achieve better balance. It's done for people who have disequilibrium, imbalance, and it focuses on compensation of the brain when there is a deficit in any of the balancing organs, such as eyes, ears, or legs and feet.
Are balance issues the same as vertigo?
No. If we divide the symptoms of balance disorders in general, we're going to divide them into vertigo, which is that spinning sensation, balance issues, and if somebody has balance issues, they may never have a spinning attack. They may say, I'm fine if I'm sitting in a chair, I'm fine if I'm lying down in bed, but when I get up to walk, I'm walking like a drunk. That's balance issues. Vertigo is a spinning issue, and then you have the broad category of lightheadedness, giddiness, I feel dizzy, without spinning vertigo and without imbalance, and that's the third category of balance disorders that we have to diagnose and treat.